Hi, my name is Mike. My story is about gout and suffering from gout. I've been suffering from that for about a year, and I've been going to nutritionists and dietitians to try to control my uric acid in my blood, and I just couldn't get rid of the gout, and it kept getting worse and worse. And my wife introduced me to a friend of hers that had OPCs, and I at first put them up on the shelf and thought that they were kind of an odd thing, and I didn't think I would take them. And luckily one day I ran out of my gout medicine, and I started taking them, and within 4 days pretty much took away all the cramps that I had in my feet, and the swelling in my feet went down. And I haven't taken any gout medicine for the past 6 months, and it's been a wonderful feeling. I haven't felt like this in probably 10 years. All my joints feel good, and my feet are actually loose in my shoes. And when I had gout, I had to purchase new boots about every 2 months. I had to have them custom made for my feet. It's very expensive, and I'm so grateful that I've found this product, and it's helped me in my life, and it's helping many other things that I've had wrong. My cholesterol levels have dropped in my blood. My uric acid is back to normal, and all is going well.
I'm Tony. My health problems started about 8.5 years ago upon my return from Desert Storm. Had problems with aching joints, muscle spasms, oozing rashes, intestinal problems, inability to sleep. I had all these problems that continued to worsen, even when I got out of active duty. Went to all the military doctors, went to over 30 different doctors, different health centers here in Michigan when I was done. All of them tended to say that it was post-traumatic stress related, even though I continued to get worse and show physical signs of my ailments. Just over a year ago, got to the point where I couldn't walk around the block with my wife and 2 small children without being in tears. About 9 months ago, my aunt introduced me to some natural health products, OPC. That's what I first started with. Within a 2-week time period, I noticed a change. And then probably a month later, my wife noticed a change, and my family noticed a change in my attitude, and just the fact that I had a smile on my face again. I'm not saying that this is a cure-all for everything, but I no longer have rashes. I can sleep at night. I don't have tremendous mood swings. And my intestinal tract is right.
Well, my name is Dr. Daryl Fortson. I'm a family practice physician in the Northwest Indiana area. I've been in practice about 8 years now. And I was exposed to OPC through another physician colleague of mine who lives and works in the Washington, D.C. area. And he was telling me about this outstanding nutrient that does a lot of things for people with arthritis, asthma, people with multiple sclerosis, with chronic allergies. Now, I'm traditionally trained as a physician. I'm a board-certified family practice physician, so this was kind of a new foray for me. I usually use traditional, almost always use traditional medications for my patients and traditional treatments. So this wasn't anything that I was particularly used to doing or trying. And I gave it a try with several patients, and one of the first ones was a lady who was in her mid-50s who was on disability and crippled by severe rheumatoid arthritis. She had rheumatoid changes in her hand that were quite disabling, in her knees. She had degenerative arthritis of her neck, of her cervical spine and lumbar spine. So her neck and back were injured from her arthritis. She also had carpal tunnel syndrome, where the nerve that comes through the wrist into the hand was pinched, and she had a lot of problems gripping things and what have you. Plus she had wrist drop, where she couldn't keep her wrists up because of some of the problems that she had coming out of her neck. So she was really debilitated. And she came at one point, we were increasing her pain medications. She was taking steroids. At one point, she was taking injections. She had had surgery, and she just wasn't getting any better. And she had come to ask if I would order a mobile device for her, like a scooter, a motor scooter for her to get around in her house and for her to do her shopping and what have you. But in the meantime, I didn't have much else to offer her. So I decided that I would try the OPC. I didn't have anything to lose. About 2 or 3 weeks after, however, she comes to the office. I'm in the office seeing patients, in a room seeing patients, and my nurse calls me out and demands that I come out immediately to see what's going on. So I come out, and I think some patient passed out in my office. Come to find out, here this lady is doing toe touches and back bends. She didn't have her cane. She had left it at home, didn't really even know where it was because she wasn't using it, had lost 12 pounds, and had the unmitigated gall to even start running. But I know that she was moving and doing things better than I had ever seen her in all the time that I had been in practice with her as her physician. And it was about that time that I really started to believe in the power of OPCs, patients with fibromyalgia, for patients with severe asthma, and I continuously saw improvements in all of them. One of them was an asthmatic patient who had a cough that just wouldn't go away. Steroid inhalers didn't work. Oral steroids didn't work. Antihistamines didn't work. Nasal steroids didn't work. Worked her up for a tumor in the bronchus or in the airway somewhere. Nothing would help until I started her on OPC. In fact, I had sent her to Mayo Clinic, and they really didn't have much to offer her until she came back and tried the OPCs. And she hasn't had any problems since. I had another patient who went through a similar rigmarole and didn't get better until they started the OPC. The third person, I finally got wise and just started them before they spent thousands and thousands of dollars. I continue to see patients with rheumatoid arthritis being improved, multiple sclerosis. People note that they have more energy. One of the most curious things is that when you look into antioxidants like vitamin C, vitamin E, you see in the literature that they're used to treat things like macular degeneration, which is a chronic, irreversible retinal disorder where the vision deteriorates in aging. People with diabetic retinopathy or diabetic eyes are also improved somewhat with antioxidants, but I've seen dramatic results with the OPCs. A patient just came into my office last week who is going blind from diabetes. He's blind in one eye, and his vision was severely diminished in the other. In fact, he had surgery on both eyes, and it's not yet clear whether he's going to be able to retain his vision. But during the time that he was taking his OPCs, his vision dramatically improved. Again, I can't say enough about OPCs. I think for the skeptic, they need to look at the literature and see that it's legitimate, to see that it's well tolerated. I've had good results with my patients, and I take it myself, in fact, and I would recommend it to anyone as both a supplement to help them improve some of the medical conditions that they might have, or to help to maintain their health, because antioxidants are always a good idea for anyone who's concerned about their health.
I'm Larry Curtis, and I'm a pharmacist, a large traditional pharmacy as well as a natural wellness center. I'm here today to talk to you about OPC. OPC has been the most successful product for my patients in the bridge between traditional and alternative medicine that I have come across yet. OPC seems to provide benefit for nearly every user. I have a slogan that I use, and that is that wood rots, iron rusts, and bodies age. Why not prevent this from happening with OPC? I have had patients with fibromyalgia, I've had patients with arthritis, I've had patients with many other chronic conditions that after a short time seem to do better with OPC. The beauty of OPC in my setting is that traditional medicine is expected to work very quickly. Alternative medicine is known to build up effect over 1 to 2 months. With OPC, we see effect in an intermediate amount of time. OPC has provided benefit to more of my patients, I think, than any other natural medicine alternative that we have in our facility, and I would recommend it to nearly everyone.
My name is Lisa Hewish, and I'm a registered nurse in the Northwest Indiana region, and I had my first exposure to OPCs through a physician friend of mine. He suggested that I personally might try the OPCs because I have some chronic back pain and neck pain from constantly lifting patients. So I began taking it, and in approximately 3 months' time, I noticed that my vision was changing, and at that time I was wearing corrective lenses. I wore contact lenses all the time and glasses on a part-time basis. So I waited around for a little bit because I thought maybe it was in my head, but I then decided to go to the eye doctor and had my vision rechecked, only to find out that my vision had been corrected back to a 20/20. And when the eye physician asked me what I had done differently, the only explanation I had was that of the OPCs. I was extremely excited over the results that I have, and I was so glad that I got the opportunity to use the OPCs, and I would highly recommend them for anyone who has any kinds of back pain or vision problem.
So I really agreed with her because I was due for an annual checkup, and I had been feeling quite a lot of fatigue, and so I made an appointment. And within 2 to 3 days, I was in the doctor's office. And of course, they did the normals for the physical. They did the x-rays of my lungs, and they did the blood tests and everything else that goes with the physical. So a little while later, the doctor came in, and he naturally asked me how I was doing. He says, Ron, he said, I had a chance to look at your x-rays. And he says, and on your right lung, on your upper lobe, he said, there's a large mass. He says, I don't want to alarm you at this point because he said it can be many things that can be in there. He said there's infection, there's tuberculosis, and of course there is a possibility of cancer. I went in, and the doctor came into the room, and he told me, he said, Ron, he said, we've got to do more testing on that lung because he said that mass is just not a normal thing to have. So he said, what I would like to do is set you up with a pulmonary disease specialist and for a bronchoscopy. The doctor, the surgeon told me that he said, Ron, he said, even if we have to do surgery, he says, we'll have to take a real good look at it because he said, you've only got about 33% breathing capacity. Now this is where the amazing thing all takes care of my life. And I probably don't have enough time to explain to you how I really felt. So I took this for a 6-month period and made an appointment for 6 months. I went in, and the doctor x-rayed me. He came into the room, and he looked at me, and he says, Ron, he says, the mass has gotten smaller. He says, I don't know why, but it really has gotten smaller. And of course, I knew in the back of my mind what was doing it, and I was really ecstatic, and I couldn't hardly wait to get outside so I could scream with glory on it. Now here's the glory of all glories. I went back in another 6 months. The doctor came into the room after the x-rays, and he really didn't say anything. He just stood there, and he looked at me, and he looked away, and he looked back, thumbed through his paperwork, and he says, you know, Ron, he says, the mass is gone.